to your needs. So we've tried to do that, and we've tried to work with the public health organizations to provide the content expertise, but also the groups that have bachelor's degree programs already that could articulate with the community colleges. So we've been working on, this is truly an alphabet soup of public health. SOPHE is the Society for Public Health Education, and they're an important group in terms of health education and how that might relate. They have bachelor's and master's degree programs at this point. AUPHA is the Association of University Programs in Health Administration, and they have quite a few undergraduate bachelor's degree health administration programs. AEHAP is the Environmental Health Group, and environmental health is a long tradition in public health at the bachelor's degree level. And then there are two practice organizations, ASTHO and NACCHO. These are the state organizations and the county and city health organizations, and they represent governmental public health. And so we wanted to be sure that we had a solid grounding in at least the part of the job market. And we also wanted to be sure that there was good articulation with a bachelor's degree, and we've been working with the AAC&U. So this was not, it was the League and the Association of Schools and Programs, but it was more than that, that we really tried to engage the other groups as well. And we came up with, we had a long list of possibilities, and we came up with two what we are calling prototype curricular frameworks, or model frameworks, that provide 30 credit hour either pieces of a degree, or that would be either freestanding as a academic certificate program or as 30 credits of an associate degree. And the two frameworks we came up with were public health, we call it public health generalist and specializations, and I'm going to talk to you about what that means in terms of what we mean by the specializations. And secondly, one called Health Navigator, and that one needs a little more explanation, and it's in a sense it's a new activity. The public health and generalist and specializations is a natural extension of what has been happening at the bachelor's degree level. So its primary aim was to articulate with the bachelor's degree, whereas the Health Navigator is fundamentally a community college activity in which with applied associate degree, but also with the potential to articulate with the bachelor's degree. So we tried, and they're really quite different, and so we're going to talk about each of them separately and focus on them. Okay. So, let's see the next slide. There we go. Now, so each of these had what we call prototype curricular models, and as I said, they were designed, each of them as 30 semester credit hours, and each of them had shared some introductory coursework, and that was important because in an institution that has a full developed program, we see these as common core that students could enter into and then select from some of the specializations or the Health Navigator. So what I'm going to talk to you about first is the foundations and core public health curriculum. And we think those courses will be of interest not only to people going into this area, but they'll be useful for general education. They'll be useful for nursing and allied health, potentially. And so that the foundations and core curriculum are a good starting spot for people who are going to be getting into the development of this curriculum. And then for each of these, there are specialty curriculums, and or if for those who are in a generalist program, introductory course from each of the specialties. Another principle that we worked on that certainly is consistent with everything I've heard about what goes on in community colleges is the experiential learning. And I think that's one of those elements that's shared with public health. That's really is a critical part of any degree program, is the experiential learning. And finally, the having electives was important because in these fields there are a lot of areas that have job orientation that require some very focused coursework. So we also included in each of our models some electives. So each of the models you're going to see has foundation and core, has a specialty curriculum, has experiential learning, and has electives. And by the way, all of this is available, and we'll see this a number of times on the League's website. And Cynthia will tell you more. They've done a great job of putting this together on their website. Okay, so what do we mean by foundation and core curriculum? Well, as I say, both of them have this, and what the core curriculum is really first of all, it's built and connected with. This is the assumption for somebody getting an associate degree is that this will complement a strong oral and written communication skills and basic quantitative skills. That this is not for people coming in without previous credentials, that this is that this complements a strong general education emphasis. In the three courses that we thought everybody who goes into a public health focus, and ideally many people who are in general education will take, are three courses. One has been called Human Health, or Personal and Population Health. Or as you probably know, there are a large number of personal health courses at the undergraduate level at both community colleges and four-year colleges. What we're promoting is a course that takes the personal health, but also includes the personal health, but also includes a focus on the population, the environment, the determinants of health, that is helps students understand not only what they do, but what is done as a population, as a group, as a society that makes a difference in health. So it's a combination of the personal health and the population health, and that we think that that should be a modification of what is occurring in many schools already. Secondly, they should have an overview of public health, and they should have a general course that really does cover the landscape. It can be global, but it often in this context is domestically oriented. And there are formal frameworks for that have been developed. And by the way, most of these courses that I'm going to refer to, the report is very specific. It outlines course content outlines for these courses that are geared to really providing a framework for the course, something that could be slid very easily into a syllabus. And then find the third piece of that is the health communications, and so that human health and personal and population health, as I like to call it, an overview of public health and health communications are three courses that would be part of both curriculums. Okay. Next slide here. Okay. Now, the public health generalists and specializations is designed to either be a generalist course that could transfer to a generalist bachelor's degree program, or into a specialty area. And there are three specialty areas that I referred to that are the areas in which there are coursework, there are credentialing and accredited programs at the bachelor's degree level. One is health education, the second one is health administration, and the third is environmental health. So we are looking, each of these groups that we're working with produced a introductory generalist course outline. So that, that one way to do this is to have a generalist program that asks people to take each of those courses. A second way to do it is to have an more intense program with three courses in one of these three. And either option is available and is encouraged as part of this report. So let's look a little bit at what each of those three specialty areas. The Society for Public Health Education, as you'll hear, has been very involved in this. They actually set up their own task force on community colleges. They outlined in detail three courses that they are encouraging students to take at the community college level if they would like to transfer to their bachelor's degree program, which leads to what they call the eligibility for the CHES examination, the Certified Health Educator exam. And those three are Introduction to Health Education, accessing and analyzing health information, and public health advocacy and leadership in action. And each of those 3 courses has course content outlines included in the report. The second one is environmental health. And environmental health is a little different in the sense that they have a strong science base built into their expectations at the bachelor's degree level. So they do want students to take some basic chemistry and biology as part of their preparation for this program. And then they've outlined courses specifically in environmental health that they would encourage as part of a focus area. One is the overview principles of environmental health, and then they've outlined 3 courses that they would think would be reasonable, and we suggest that students take any 2 of these. So only 2 would need to be offered by a program. One is called Disease Vectors and Control, a second, Solid and Hazardous Waste Management, and a third, Food Safety and Sanitation. And these are all very job-oriented and very specific areas. And once again, they've provided course content outlines for each of these. And then the final one in the specialization is health administration. And health administration is clearly a discipline that has both bachelor's and master's degree programs attached to it. And they were recommending and have outlined specific course content for introduction to health administration in the U.S. health system, to management of health organizations, and to health information systems, which are becoming increasingly important, as I'm sure you know. Now, so that's the specialization that we're calling public health generalists and specializations. That's what we call the prototype curricular framework, and the report contains a great deal of focus on that and a great deal of detail, which you can look at, and hopefully we'll see some of the areas that might be compatible with your mission and your resources. The second prototype curriculum framework is, as I say, quite different. We're calling it Health Navigator. And the name itself actually was one of the big issues in how we were going to do this, because this is a very dynamic and growing field. And when you look at the job market, the problem is not that there aren't job titles, it's that there are so many job titles. We've identified something like 36 job titles. So that what we thought was critical from the standpoint of the community colleges is that we provide a umbrella curriculum that allows people to be prepared for a variety of jobs. And we've kind of coalesced that around 3 basic areas. One is sometimes called in the job market community health worker. It's the people who literally help people in the community identify prevention opportunities, how to everything, and working with everything from nursing homes to hospice to nutrition. So that's a community-based preventive activity, and and that's one of the kind of cores. The second one is healthcare delivery. As most people who've had experience in the healthcare system know, it is the most amazingly complex system you could imagine, and helping people get through the system, everything from being able to communicate with clinicians to getting follow-up appointments, and to understanding what's said to them in terms of what they need to do, is a critical role. And so that the whole healthcare delivery area is becoming key. The third area is health insurance. And once again, we have such a complex system between private insurance and Medicare, Medicaid, and as well as the VA and all of the other institutions that are involved in getting care, that people need some help in understanding their health insurance needs. And from the job standpoint, the good news is in the last few years now, there really has been our paid roles in each of these areas. But what we've heard from the community colleges and what we've heard from the job market is that people need not to have one of these, but if they're going to be versatile in the job market, they need to be able to do some community and preventive. They need to do some hospital-based healthcare delivery coordination, and they have to help people with their insurance. And that the program that's developed by a community college ideally includes all three of those aspects, both in its curriculum and also in its experiential opportunities. And if that can be accomplished, that there really is a role for an associate degree or an academic certificate program, also with 30 credit hours. So the bottom line here is that we're looking to see this become, Health Navigator become at least the academic term to provide an umbrella over this growing field. That it includes, we're going to go through the coursework that is designed to include, and that it has experiential and learning and electives in the same way that the other programs that we've talked about. So, so what is in the Health Navigator? Well, it has the core curriculum that we already talked about, but it also has the accessing and analyzing health information. But then it has three key required courses that we hope will fit together and will become a curriculum that people will pursue: prevention and community health, healthcare delivery, and health insurance. And that's kind of the core Health Navigator curriculum that we would like to see develop in a wide range of community colleges. And then finally, as we said, as with all of these, we would like to see experiential learning and electives as based. And the once again, the content outlines for each of these courses are included in the recommended content outlines are included in the report. As I said, Health Navigator programs can be academic certificate programs, applied associate degrees, but in addition, SOPHE, the Society for Public Health Education, who has the health education bachelor's degree, wants to encourage graduates to be able to transfer to their bachelor's degree programs. So we have, the strategy that we've developed is to engage the bachelor's degree programs in wanting to see the community college graduates come into their programs, and we hope that'll make articulation a lot easier. We've also been very clear that there has to be flexibility. The job market is diverse, the state regulations are diverse, and so that you're clearly going to need to be aware of your local situation as you develop these programs. We also have found that because many community colleges have such strong activity in the nursing area, in the allied health area, and in some cases the social service area, that there will be students who see the academic certificate of the one-year program as a logical add-on to their associate degree in nursing or their other associate degrees that they might have that would broaden their job market flexibility and get them into roles that they think will provide additional opportunities. So we see this as both a freestanding program, a transfer program potentially, and also an add-on program. And I think that's important to appreciate. There are multiple ways to do it, but we've tried to carve out channels to do it in all three different basic ways. Okay, just a summary of kind of what we've been, the continuation. As I said, the Society for Public Health Education, SOPHE, has been very engaged in both the specialization and in the Navigate, and they are continuing to do that. Their board has endorsed their continuing active participation, and they are prepared to try to help community colleges who want to articulate with their programs, as well as develop Health Navigator programs that are consistent with transfer. Then we have the next slide is gives you a sense of the website that the league's put together, and there's a lot on there, and in a minute, Cynthia's going to tell you more, but the report document that we've developed called Recommendations for Design, Approval, and Implementation. We heard that you want details about the job market and getting approval and implementation issues. So we have a document on the website on that. We have public health resources on undergraduate in general and community college in specific, and then the call for planning is also included. So with that, I can take some brief questions now and then turn it over to Cynthia and let her talk to you about what we hope you will be participating in the call for planning, with the idea that you would be interested in seeing whether it makes sense for you to develop a program, to start a program hopefully in 2016.
Thank you, Dick. You did get a couple of questions. One, for the Health Navigator programs, you referenced certificate. Do you envision a non-credit workforce industry certificate being relevant?
Well, you know, we asked, I have a PhD student, Kate Johnson, who both Cynthia and I have been working closely with on it, and she asked the community colleges that question, and they basically, even though there are a lot of those programs out there now, that was not the direction that we heard people wanting to go. And I kind of agree with that. I think that one of the things that's important here is that this field become a profession, and that it has a history, frankly, of on-the-job training. And I think we need to move it into the academic range, and that academic certificate programs and associate degrees should be the major focus for the future.
Okay. Another question. Health communications are often 300 and 400 level courses. How can the community colleges help when our courses are 100, 200 level?
Well, I think that they may need to have slightly different titles, but the concept of communication and how it applies to health, I think, can be taught at a 100 and 200 level. You may have some specific issues about how you frame that, but in many places, the key concepts of health communications, you know, the students are far ahead today with all their ability to handle the media, and so I think that you'll find that many freshmen and sophomores are raring to go for this kind of thing.
Okay, and then a third question. I'm currently a faculty coordinator for a Health Navigator program at a community college. Is there technical assistance available from SOFI or other organizations to review our current curriculum for recommendations?
I think we should get a request for that, and we can see what we can do, because they certainly will. Cynthia and I are meeting with the executive director next month, and that's the kind of thing we'd love to be able to discuss with her.
Are there other questions? If you think of any in the next few minutes, just go ahead and put them up, and I'll go ahead and get started on the on talking about the call for planning, and we'll do the same thing. As you have questions, just go ahead and put them up, and then at the end, we'll respond to as many of them as we can. Again, thank you, Dick, for that overview of the project. And we've been talking about the call for planning, and so we have in our current phase of the project, we want to continue the work. So we decided to go forward with this call for planning in inviting community colleges to at least indicate that they're interested. And so we have, we're interested in programs in community colleges that are interested in planning programs that follow the CCPH, our project's recommendations, the public health generalists and specialists, and the Health Navigator curriculum frameworks that we have in the final report. But they don't necessarily, those are guidelines, so we're not saying it has to be exactly like that. They're just frameworks. But we're certainly looking for institutions that are interested in developing these kinds of certificate and associate degree programs for in community colleges. And what we're asking for initially is just a letter of intent. We intend to plan to do this, and that letter of intent is due April 17th this year. And what the letter of intent needs to include is an indication of which or one or both of the model frameworks that you're interested in pursuing or in planning, whether you're doing certificate or associate degree programs or both. We're interested also in innovative design, so any kind of alternative approaches to doing this are certainly welcome. The letter of intent also needs to include the CV of the faculty lead and the planning process. And we also want an indication of the types of administrative support that that the college or the administration is willing to provide, a release time, a reassigned time for the lead faculty, for example, other kinds of support for the planning effort. And then the letter needs to be signed by the chief academic officer at your institution. And then you send that letter to me, and my email address is going to be on the last slide, but you have it, I think, because you got messages from me all along, wilson@league.org. And just send the letter to me, and then in April, after the 17th, we'll review those for eligibility, and we'll then send you a notification of your eligibility by May 1st, and that's actually on another slide. The call for planning is open to individual community colleges as well as community college systems. So your district, if you're part of a district system, an individual college within the district or the district itself, or even if you're part of a statewide system, that would be great. And it's open to new and existing public health programs. We are interested in, particularly in as we said, the public health generalists and specializations framework and the health navigator framework. But if you have an existing program and you are interested in starting or in adding to it or starting a new aspect of it that follows those frameworks, then you're certainly eligible. And partnerships with transfer institutions are encouraged, but they're certainly not required. Particularly if you're looking at the transfer degree or the transfer function of these degrees, that would be an advantageous, but it's not a requirement. We just encourage them. And then, as I said, we'll notify institutions of their eligibility by May 1st. And what eligibility means is that we have a series of activities planned over the coming months to help colleges as they're developing their plans. And eligible institutions will have access to these activities. And one of those is a series of webinars that we're planning with public health, academic, and practice organizations that Dick was just talking about earlier. We're working with them to set up webinars so they can talk with you about the work that they're doing and how it relates to what the community college programs might look like, and resources that are available to you that you might not know about. So those will be starting in May, and we're planning 2 a month through the summer. So there'll be, I think, 6 to 8 of them altogether as we're planning them, again, throughout the summer. And again, the eligible institutions will be the people who have access to those webinars. There are also opportunities for consultation. This kind of gets to the question that was asked earlier about technical support. We are working with these organizations, and as Dick said, we'll be meeting with the executive director of SOFI next month, and that's one of the things that's on our agenda to talk about. Opportunities for consultation on program planning and implementation with people who are really experts in the public health program planning. And then finally, the actual plan that each college has would need to be submitted by December 31st, 2015, and that we're developing a template for what that plan would include, and we'll have that finalized within the next couple of weeks, and I'll certainly send it out. I have all of your contact information, so I'll go ahead and send that out to you as soon as it's finalized and approved. But it's let's say this, really not, I think it's the same kinds of things that you're going to see in whatever you're having to do internally anyway. So, so we've been looking at what kinds of elements these sorts of program planning processes have as we're developing the template. And the elements that we'll have are fairly standard: a statement of need, projections of future need, the college's experience and capacity for having a program like this, what kind of partners or advisors you're working with in an advisory group. If you have articulation partners, then you know what kinds of work you're doing with them, who they are. A basic overview of the curriculum. Are you looking at a certificate program, a degree program, both? Are the certificates stackable, leading toward a degree, that sort of thing? And then who is your audience for the degree? Are you looking at new students or current people who are currently employed that are needing to get or wanting to get a credential of some sort, or both? And you know, how are you addressing those needs? The kinds of support services that you plan to have available for the students. And of course, cost, what it's going to cost for the institution and for the students, you know, the financial aspect of it, revenue that might come in to help offset some of those costs. And then an implementation plan, you know, what's your plan for rolling this out, and then a program review or evaluation. So again, just really fairly basic kinds of pieces to this will be part of the template, and I think I've probably covered most of those, but that's the kinds of things that we'll be looking at. But and again, probably the same kinds of things that you have to do for your own institutional process, or if you have a state requirement or some other kind of requirement, that external requirement that you have to meet. That this will probably complement that rather than be in addition to. Then what we are also planning, and we're very excited about this, is to recognize the exemplary program. So up to 10 community colleges or systems that submit a complete plan. The plans will all be reviewed, and we'll recognize up to 10 of those institutions at the Innovations Conference next year in Chicago. The dates are there, and we'll provide a $1,000 stipend for travel expenses for one person to attend the conference, and they'll get a complimentary registration to the conference for one designee from each of the recognized institutions. And the recognition will occur during one of the general sessions at the conference. So we think that's a great opportunity for community colleges work in public health to be recognized on the national stage, and we're very excited about that and looking forward to it. Then in reviewing the plans, we'll be looking again very generally at the quality of planning for implementation and evaluation, the institutional commitment, which is of course very important as you're doing something like this, as you all know if you've ever created a program at an institution, and then the evidence of interest and support by students, by the administration, and by the local community. That's also kind of part of that needs assessment that we'll be looking at for the review. The colleges that are recognized will have their plans posted on the League website as part of our Community Colleges and Public Health project, and they'll be invited to participate in authoring articles about their work that we'll submit to various journals by the mid-year in 2016. And then we'll also be encouraging those colleges to provide advice and consultation to other colleges through webinars and presentations, and even individually to those other institutions that are interested, because you'll be the vanguard, you'll be leading the way for in a lot of cases. We are also seeking funding to support implementation and evaluation of these what we're calling demonstration programs. We have been fortunate to have gotten a little bit of funding to help us so far along the way, and we're looking forward to hopefully getting some additional funding, but we're certainly looking for it. And the recognized colleges will have priority for this support if we are able to get the funding. So to help continue the planning and implementation of the new programs. And I just want to leave my contact information up there because as you have questions after this, I'll certainly be able to answer them, be happy to answer them. And I'm scrolling back up because we now have lots of questions, so we'll go to those.
Can I just add?
Sure, yeah.
If we do that, Cynthia indicated that the webinars this summer, and that's going to be a core piece of this. And so we would appreciate your feedback on what you want. We do have a tentative outline for the webinars, and they include not only looking at the report as a whole, but a webinar put on by the Association of Schools and Programs of Public Health to give you an overview of public health education, one put on by the health educator, Sophie, another by the environmental, another by the health administration. So each of the participating groups would put on. And then if assuming that this is of interest, we also envisioned a couple of webinars that would focus on health navigators and the opportunities there, since that's a really new and dynamic area. But we also are open to other kinds of things that we might offer through webinars. So either now or certainly by email, we would love to hear more about what you want to be included.
Right. Thanks, Dick. Yeah, we are very interested. So use that email address to let us know what you think would be very useful in those webinars, because right now they're in the planning stage. So we have an opportunity to shape that with your input. Okay, so one of the questions is there a credential available at the associate level currently? And Dick, maybe you could field that question.
Yeah. In general, the history is that there hasn't been much public health education, at least called public health education at the community college level. So there haven't really been credentialing. The credentialing really exists at the bachelor's degree. There's been no accreditation, and now the accreditation is just beginning at the bachelor's degree. So I think that there are states that have licensure requirements for pieces of the Health Navigator, but there are not. There's not either accreditation or a certification that occurs at the community college level.
Okay. A next question is, can you give us examples of community colleges that are offering any of these new curricula? And there are a few, and there's a growing number, but it's still a fairly small number. We know, well, Dick had a graduate student a few years ago who actually did a study looking for those community colleges. Dick, do you want to talk a little bit about that and then some of the work that's happened since then?
Yeah, we found, a handful of them that have existed and prospered and quite diverse, some in Mexico and New York City, in a variety of different settings. But this is really a new era and a new initiative. And we're seeing, the encouraging thing is we're seeing systems looking at what they can do. The University of Washington system is looking at how community colleges can work with their School of Public Health. New Jersey's doing that. I'm going out to a 3-day meeting that the University of Chicago and University of Illinois at Chicago is having to do this. There's efforts going on in Florida. There's efforts going on CUNY, the City of New York, University of New York. Is developing a whole system that will develop this. So we're seeing enormous interest in a variety of places. There's an initiative going on in New Orleans. And in addition, certain states have actually taken quite an effort, taken the lead in the Health Navigator area. Texas and Minnesota and Ohio are all have state initiatives that are oriented toward this. So we're seeing enormous amount of activity, but most of it is really just beginning. So even though it's not the very ground early work, if you get involved, you will certainly have the potential to put your mark on locally and nationally.
Okay, and then the next question, how do we get more information about the letter of intent? And there is there's information about it in the call for the call for planning, which is on our website at www.league.org/CCPH, and you can find the full call for planning and the list of what needs to be included in that letter of intent is I think pretty well spelled out in that. If you have any other questions, though, do send me an email if you have something a little bit more specific that you wanted to know about. And then the next question, will academic division matter? In other words, would proposals from student affairs division be considered, or social sciences? And I think that that's again one of the areas where we can see some innovation, but I think initially the thought is that these might come from an allied health or nursing or health related program, but in actuality they could really come from a lot of different places. Isn't that right, Dick?
Yeah, we're looking to be surprised. We hope that you will think about your institution and where it will work best. I think if you can justify where it goes, I think that's really, you're the experts on that.
Yeah. And then in terms of experiential learning, would cooperative education at the community college working with the college population be considered experiential learning?
I think so.
Yeah.
I mean, Cynthia, you might want to comment on that.
I think, yeah, cooperative education, it certainly seems like that's the kind of thing that is experiential, and if it's the college population, I think in some of these, some of the areas that we're looking at, some of the specializations, especially, it would make a lot of sense, someone to help.
Yeah, absolutely. I mean, if you work in a student health service, or if you do projects that are internal to the student body, that's experiential learning.
Absolutely, yeah. And then, are there specific credentials required for lead faculty? I think that's a question.
Yeah, well, that's an unexplored area. Sophie would like to see some specifications about the requirements, but they tend to be master's level requirements. And so I think that the answer is we don't know yet, and that you need to give us your thoughts on that.
Yeah. And then a request to send the presentation to attendees, which I absolutely will do. I'd be happy to do that. I'll also send a link. We're recording this part of the presentation that Dick and I are doing, so we'll have that available as well if you want to go back and review it. Then, will you share the 36 job titles you found were associated with the health navigator? Yeah, coming soon.
Well, yeah, we'll try to. I'm hearing this. I don't know if I have that list, but we do have. We're literally hearing numbers. I'm hearing people quote those kind of numbers. It varies all the way from HIV navigator to diabetes navigator to cancer navigators to Medicare and Medicaid navigators to health guardians to it goes. It's amazing, the list. New ones pop up every day, which says there's interest, but it also says to me that the community colleges have to provide a coherent curriculum that is applicable to a variety, that we can't have 36 curriculum to respond to each of the job titles.
And then, would community college graduates be employable if there is no existing certification?
Well, I think that's the very nature of this evolving profession, is that there isn't a certification process. Will that occur? Probably eventually there will be, because of the way, but the field is not requiring it at this point. The field is really trying to get its act together to have a coherent sense of what the job is. The good news is there are now a general agreement about the level of salary and the level of advancement, and that's coming out of some of the federal initiatives in terms of the wage scales. And we're hearing entry levels in the low 30s, and we're hearing supervisory in the 55 or above. So we're beginning to see a coalescence around what these jobs might be, and how there might be internal advancement within the jobs. So I think you're dealing with the work in progress, but you're dealing with the work that is moving very fast and is certainly moving toward developing this as a profession.
Okay, and then there's a question, would it be possible to ladder the navigator into the public health associate degree? And I think that's kind of what we're hoping happens, if I can say that out
Yeah.
loud. we
Yep,
want that to
absolutely.
happen. Yeah, go ahead, Dick.
Yeah, no, I think that's absolutely. The Health Navigator is got such potential to become a core curriculum at the associate degree level, and we see it as hopefully in 5-10 years, right along with nursing and allied health professions, as a model that will be core to community colleges' activities.
Okay. And then, Dick, a question for you specifically. Do you want to encourage folks to join the conversation about Health Navigators on the blog?
Yes, absolutely. Yeah, no, I think that we're beginning to see that, and Kay Perrin is doing a great job to really get that off the ground. And please, your active participation in all of this will not only make it happen, but make it better.
Okay. And there's a specific question about, I think it's a follow-up from a previous question specifically about Florida, about credentials available at the associate level in Florida.
I'm afraid I can't speak to specific state issues. I don't know the details of what's happening in terms of credentialing. I am aware of the credentialing process in Texas, Minnesota, and Ohio, but I'm sure that's, as I say, that's changing by the day.
Right, right. So yeah, the specific information isn't always available. So so are there any other questions? I think we've gone through the list. Where she's wanted to know where programs are being created in Florida. Is that, do you know?
I think that Kay Perrin can probably speak to that, and I don't know the answer specifically.
Yeah. Okay. Any other questions? We still have just a couple of more minutes, but we might be questioned out. So.
Well, do send questions in too, because I think I think the more you get into this, there are a lot of questions, but there are beginning to be some answers, and I think that's progress.
Right, and I think that's a really important way to put it. There are beginning to be some answers, and some of these it's a little bit messy because we're kind of at the beginnings yet, but this is where we have a real opportunity to shape this for the future, and this all came out of that Framing the Future task force. That's what this is all about. So a really exciting time for public health education and for community colleges. And we're, again, as I said at the beginning, very excited to be part of it. And look forward to hearing from you. And as I said, we'll be sending you the link, and I can send you the slides if you want just me to send you the PowerPoint. I'd be happy to do that. Oh, we got another question, and we still have enough time. So does experiential learning have to be in one class, or can it show up in different classes?
Yeah, we actually were explicit in the report that there are a variety of ways to do experiential learning. We're finding we suggested, if possible, that there be a course and a credits attached to it, but we're hearing that in some places that's just not within the rules of the game. So so we emphasized experiential learning and compatible with your institutional priorities and rules.
Mm-hmm. Okay. Anything else? Well, then we'll thank you all for spending this hour with us, and look forward to hearing from you. If you have, as Dick has said, if you have any other questions, please feel free to send them. My email's right there. I'll be sharing them with Dick, so you'll get answers for both of us, and we just look forward to hearing from you. So again, thank you, Dick, for joining us, and we really appreciate about all of the work that you've been putting into this effort as well. And we look forward to hearing from you.
Look forward to having further connections with all of you.
Okay. Thanks all very much.
Thank you for participating.
Bye-bye.